Yeah, be safe.
Okay, see you. Right on. Let's just go right over to the KUAM News Zoom room on the link. It's The Breeze 93.9. As promised, public health, and we have Dr. Suzanne Conashiro and one of our faves, Annette Uggan. What's up, girl?
Hey,
Half a day.
half a day.
Well,
When I messaged her this morning, I said, "Good morning, sunshine." You going
Yeah,
on?
so thanks for joining us, Dr. K. Welcome to the show. Don't worry, since you're with Annette, we have to go easy on you because she's already family. She's been on here a bunch. I guess, ladies, we'll just get right into it. Very concerning news about this backlog of tests, swabs that were run over the weekend. My message box on all the social media and the phone, people are saying, "Hey, I got swabbed. I wanted to know." I know someone who had it, and we're still waiting for the results. So, if you could tell us just right off the bat, how many tests are we backed up with public health, and what's the plan to get those tests run? And when we finally do run those tests, how can we hold the results with any validity if it's a snapshot in time from, a week or more ago? So go ahead. Ooh, Annette, can we hear? Oh, there you go. Sorry,
Again,
Annette. Go ahead. Start over. We had a problem there. Go ahead.
Oh, yes. So we have over 1,500 specimens, and that is including the specimens that we have received throughout this week. So we receive specimens. Our lab is running tests, and so it's kind of we run tests, then we receive more specimens because the demand is high. However, these specimens are being stored properly, and they are still viable and will be properly processed in order to get conclusive results. So we just want to reassure the public that these the swabs that were received over the past few days are being stored properly, and that they are still viable when they are going to be tested. We do understand people's concerns about waiting longer than normal. The public has been turning around results normally 24 to 48, maybe 72 hours in the past. And that actually was, we had that turnaround. In the mainland, people were seeing 3, 5, 7 days. And so now with this overwhelming turnout that we had on Saturday, yes, it's increased our turnaround time. However, public health is working on testing every single day. And so we actually received a shipment last week of test kits, and we burned through that quickly. And that comes from CDC. And so again, we're receiving a shipment today, so that will increase our ability to test more on a daily basis. Our staff is working diligently, longer hours every day to catch up on this backlog. And we have our partners we are also using other testing platform, like at Northern Public Health, the Northern Region Community Health Center. They are all Abbott ID, and so we're expanding our testing platforms and strategies so that we can catch up on this backlog and give people the results in a timely manner.
You said 1,500 samples?
And this is coming from all providers, be it public, private, and the hospital, sir.
Right. So let me just Dr. K, good morning.
What is the shelf life for these samples? Like, how long can you hold them before they
rotten?
Yeah,
or they're not usable anymore.
So 72 hours in refrigerated, and then you freeze them, and then they can stay there longer for as long as they need until we test them.
So as long as you freeze them, we can test them next year?
Oh, no, that will be tested in the next few days.
No, I'm asking what's the shelf life? Like, how long is that going to be good? You said 72 hours refrigerated. Then if you freeze them,
refrigerated.
Right. So how much longer after they're frozen are they still going to be good to be ran through the machines?
They can last for several months, but again, our goal is not to wait that long.
Yeah.
As soon as we're getting our specimens, we are trying to test them as quickly as possible.
So, Dr. K, the specimens now are in the freezer?
Correct.
It's in the lab. It's in the freezer in the lab.
Okay, that's got to be a pretty big freezer. Is it like a
We
walk-in?
have several. We
Okay.
have several freezers.
Okay. So let me just ask the obvious question here, right? And this just goes back to the snapshot in time comment that we had from Dr. Michael who was on the Governor's Physicians Advisory Group. And we had people go get tested over the weekend. And, so maybe we'll start there. How many tests do we have left over from the community mass testing that took place on Saturday was it GIGO? And
Yeah,
then also
GIGO and then-
SDA and AMC. So how many of those tests are left from the weekend?
Yeah, we are. Hello?
Yeah.
Hello?
Yeah, we're here.
Sorry, there's like a interference or something.
Yeah.
So we are, how do I say this? We are prioritizing specimens as we receive them. And so we do have a mix of specimens that come in for priority testing, like at the hospital,
Right.
or a symptomatic individual or someone who needs pre-surgery clearance. And so our lab staff is balancing testing the ones from the community testing as well as those that were received and requested for stat testing. And so right now, we have a mix of those specimens from different providers that our staff is pulling from to test and prioritizing as needed throughout the week.
And maybe I missed this. Are these samples only the backlog only from this past weekend, or are we talking like 2 weeks ago or a month ago?
No, just because of the overwhelming turnout from this past weekend.
Just from this weekend. Okay.
Okay, so now let me go back to if you went and got swabbed this weekend and then you went about your, business. Let's say you're one of these knuckleheads who doesn't know how to stay home and you're out there licking people's faces, touching doorknobs and just getting COVID basically. Then you get your result from when you were tested over a week ago and it's negative. I mean, is it even really worth running these tests anymore?
Again, the testing, just to clarify, the
Okay.
day you were tested will only explain past exposure.
Right.
So if you got tested and then went out and about that same day up until now, yes, you could have been exposed again. So one negative test doesn't mean you're negative, for the rest of the time frame of this outbreak. There is the need to be tested. And going back to what you said about going out and about, and that's something that we have to keep emphasizing is, and we keep hearing it, unfortunately, is people who are symptomatic are going out and about. They're still going to work. And so again, we urge the public to please stay home if you're feeling sick. And so that's where we're encountering some cases where, oh yeah, I was symptomatic, but I still went to work for so many days, or I went to a party and stuff. And so it makes it that much harder for us as a community to contain this virus, because again, we can't do it alone. We need the public's help to comply with the social distancing measures and the common sense of staying home if you're sick. Stay home if you know you were exposed to a confirmed case. You need to quarantine for those 14 days, unfortunately, because even though you're tested maybe on day 7, your symptoms can appear later on. It's different for individuals on when their symptoms start. Your immune system is different per individual. And so again, it takes a coordinated community-wide effort to help us in that, so the one test result is only a small picture in this whole response effort.
Right. So again, I mean, are we going to do anything to maybe retest people who were swabbed last weekend? Because like you said, and I think we can both agree on that it's a snapshot in time, but the problem is that time passed already. So what I had heard is that and that was that some of the doctors were really pushing for public health to get a hold of people and say, hey, should we redo this? We canceled the mass testing this weekend. So maybe if you could address again, like we get these results a week out from when they were taken, is it even worth anything?
Okay, so how do I exit here?
Yeah, I think you have someone must have the show up on a tab. Yeah, so I think you got our Facebook open. which we appreciate. I like that. You could
Not
leave it
me.
open. Okay.
Me, sir.
So that's what that is. Go ahead. Go
There
ahead.
was another iPhone being connected.
Oh, no.
Sorry, can you repeat your question?
Again, so if it's a snapshot in time and we're going to get these results, for a week and a half, and we don't know what the people who were swabbed were doing, we're supposed to be in a lockdown, yes, but like you just said, people aren't complying. So is it even worth it to run these tests? And when we talk about snapshot in time, how accurate is it going to be when we look at the surge and we add these questionable numbers into the mix?
It helps with the picture, sir, in that at least from that time you were tested, and if you felt you were exposed prior to being tested and you came out negative, then at least for exposure you were negative. Moving forward, should you feel that you were exposed, or if you were contacted that you were identified as a close contact, then yes, you should get tested again. However, our refocusing of our strategy is to really hone in on those that are deemed high risk, because again, this community testing where it was open to anyone and everyone is straining our resources, unfortunately. And so the department has gone back and said, let's refocus our testing efforts to those that really need it, those who are identified as close contacts, those who are high risk, be it because they're frontline healthcare workers and the law enforcement, the EMTs,
No testing
at
criteria.
GP, as well as the congregate settings, the elderly, and those who need surgery but need to be cleared before they go in, and those trying to clear out from travel, the quarantine, like Dr. K mentioned. And so those are the ones that we really need to focus on, because as we've seen in the mainland, we have other jurisdictions also reporting that they're burning through their testing resources for community testing, and they've had to refocus their strategy on the high risk groups, because again, it's a lot of strain on our resources, be it human as well as the test kits. And so we want to make sure that moving forward that we focus in where the highest risk is, and that we're expanding our capacity with our private healthcare partners as well, and the public community health center in the north that offers more testing opportunities for individuals. But to continue on at community testing without symptoms, it will continue to strain the system.
Right.
So that's why we need to go back to prioritize and have our strategy indicate high priority first.
Rapidly evolving.
Which, I mentioned earlier with the
And it just sounds like when I look at the triggers for moving out of this PCOR 1, and albeit the deadline, we're in this till next week, Friday or Saturday, it just seems like we might be in PCOR 1 a lot longer.
Unless they don't run the test.
If testing is one of the triggers to move forward, the capacity to test and contact tracing and hospitalizations.
And yes, that's why by streamlining and focusing on the high risk, it will give us a better picture, because then we know for sure, oh yes, these identified close contacts have been tested, but you know what? The majority of them are negative. Okay, we have a few positive, but are they household contacts? Was it community transmission? Because then we expect household contacts to become, a majority of the new positives coming from household contacts. It's to be expected because they're in the same household as a known case.
Right.
So helping us focus our testing on those who are at highest risk will help guide our department as well as the physicians advisory group and the governor on next steps. And like you said, Bree, whether should we extend or can we stop in 2 weeks? But having this casual testing, as another jurisdiction called it, makes it more complicated, because yes, we're having these overwhelming numbers of worry wells getting tested, but we also really need to make sure we're focusing on the high priority groups, because that will definitely paint the picture. Are we containing the virus because it's only at the house, or for household members, or is it only at quarantine for people who came from non-low risk areas where there is widespread transmission in their respective jurisdictions that they came from?
Dr. K, how are we going to tackle these 1,500 tests that are in the freezer? Are we looking at enlisting other places like the hospital, or does the guard have the capability? Places that have the capability. So if we're backed up 1,500 tests.
So we do have.
Go ahead.
So we do have. Sorry. So we still continue testing at the Guam Public Health Lab. So we have a ABI machine that we're using. Also, we have the Abbott machines we're using at, well, we can't use that one. So we
Why
also
can't
have,
you use that one? You said you can't
So
use
the,
that
the Abbott is not used for specimens that were done already. So the Abbott is actually done for new testing, right?
Okay.
So like, for example, if we're testing at the Northern Community Health Center, we would be using the Abbotts. So those are for current testing.
So you can't
right?
put a frozen
So-
sample in the Abbott.
Correct.
Right, okay.
Correct.
Correct.
So for the previous samples, we would use our ABI machines. We also expect our gene expert test kits to come today or tomorrow. So we're going to use those. We also have a contract with DLS to also test our specimen. And we also have another lab we can use to test our specimen, so we can get rid of all the backlog of our specimens.
How long
So
do
we
you?
do have that.
How long is it going to take to get rid of the backlog?
So it's
The
probably
7?
another, I say about another maybe 7 days, maybe,
Wow.
Yes.
So
just
if
to get through.
I got a
Because
mess.
not only are we testing that, we're also testing new ones as it
Yeah.
comes
Right.
in, right?
So
And
what's
so yeah,
Right.
so I would maybe 7 days.
so
Just
what's
to be
the
realistic, 7 days.
so what's the plan? Is it like let's run 200 from the 1500 backlog and then whatever else we're getting new? Is that how we're going to chip away at this 1500 test backlog?
So we would prioritize what's new. So for example, if we get something from GMH, for example, and they're a priority, we would run those, right? The ones that were done previously first, right? So the oldest ones first, right? So that's what we would plan to do.
Okay. And then
What happens though if, within the next 7 days we continue to see a surge in cases and more tests have to be conducted? I mean, we could keep going on and on with this
circles,
backlog.
Yeah.
Yeah. So if we have new cases, that's why we focus on the identified close contacts. The number of people that we need to coordinate for testing will be a little bit more controlled. Also, we also recommend in the testing, just because someone was exposed, normally it should be 5 to 7 days from your known exposure to be tested, because if an individual is tested too soon, you may get a false negative.
Right.
And again, the body, a person's response to an exposure, the body takes about 5 to 7 days. And so that's usually the window we're trying to get people scheduled to test. So just because if we get an unfortunate surge in cases again, we're looking 5 to 7 days from now. And so we will keep chipping away, as Chris said, from our backlog. And again, with the shipment of gene expert test kits coming in, that will definitely boost up our capacity. We have the assistance from DLS and the other lab provider to help us. We also have the support through CDC and the Pacific Islander Health Officers Association, PAHOA, where they've actually contracted another lab staff to assist us. And we've also asked, which is going to help our staff who are running, every day to clear out that backlog, as you mentioned.
How many frozen samples can public health run per day?
We normally would do between 250 to about 350 with the different testing platforms that we have available. Normally in like an 8-hour shift, you're looking at approximately 207 specimens, and that's on the ABI as well as our gene expert. But our staff are pulling 12, 14 hours or longer. And so that's why we can increase to over 300 tests a day. And that's just Guam Public Health Lab. And then we have the DLS helping us. And as Dr. Kaneshiro mentioned, Northern Community Health Center is using the Abbott, which is the point of care testing. So now those specimens are no longer coming to Public Health Lab because it's being tested on site.
Right.
When's the last time you guys have experienced this sort of a backlog?
Never.
Never.
The first time. Okay.
As I mentioned earlier, our lab was turning out 24 to 48 hours
Right.
during this outbreak, which again, even people were amazed how quickly our turnaround time was, because we were towards the top in the nation
Right.
with that short turnaround time.
Dr. K, let's say I got swabbed at GIGO on Saturday. I'm waiting for my results. When public health calls me, what is the conversation like? What do you guys say to these people who are waiting?
Well, we tell them, it's because we had a delay in our testing of the specimens, so that is why we're just telling you now the results. And it's because the turnout was so great that the interest was so great on Saturday that it actually caused a backlog in our lab. So now we're trying to test as we can, and then we tell them the result as soon as we could do it.
And then what do they say? Okay, no problem, or are they upset?
I don't. Maybe some are questioning, like for example, some are questioning how come somebody was tested yesterday and they got the results today compared to I was swabbed on Saturday and I didn't get my results. So we actually have to explain to them it's because of the way we tested with the Abbott machines, right? So you tested on the Abbott machines, you would get that result within 24 hours compared to those who were swabbed on Saturday because it's a different machine, right? So we just have to explain to them why some people got the results first because it was the way it was tested.
Right, and we see that where the senators, right, there was an exposure at the legislature, and then boom, the senators all got tested. And I thought I saw a comment where it was like, wow, they got their results so fast. So if you come into contact with a known positive and then you are contacted by public health as part of the contact trace investigation, the test that you will get will be the rapid test, right?
If you're scheduled to go up to Northern Community Health Center, we
Right
do have
now,
some contacts who are.
We are.
Sorry, Doc.
Go ahead, Doc.
Okay, so right now, if you need to be tested, we try and schedule you at the Northern Community Health Center, so you can be using the Abbott.
We had a comment here from Natasha. So do we wait to go back to work because of the backlog?
It depends on the individual. Are they identified as a close contact, and they should quarantine for the full 14 days from the last known exposure?
Sorry.
Yeah. Dr. K, are you there?
Yeah, sorry, I couldn't hear you.
Can I ask about?
Yeah.
What was the question?
Actually, we're going to move on. I wanted to ask about a situation with a woman in quarantine and what the protocols are in terms of testing. Are babies supposed to get tested or required to get tested?
So in this case, since they were in quarantine, right? Actually the doctor at the quarantine site or isolation site recommended that the baby be tested as well as the mother. So even though the mother was negative, we actually had to test the baby as well, just to make sure that the baby was negative. So that's what it was recommended by the doctor, that the baby be tested as well.
The doctor at the quarantine site? So we have doctors at quarantine sites now?
We have a doctor on call at the quarantine site, yes. We also have a doctor on call at the isolation site.
Mm-hmm. So in a matter of 5 minutes, so you're talking about Christina Leon Guerrero's case, you're familiar with it?
Correct.
Okay.
Correct.
So when the QFAC told her you were good to go, and then called 5 minutes later, no, your baby needs to be tested?
No, they told her that even though she was negative, her baby also had to be tested because she came in with a negative test.
Right.
Right. And so the baby had to also have been tested, and the baby wasn't. Okay. So we recommended that the baby also be tested.
Right. And
just to make sure.
She was just saying that it wasn't in the public health memos because she had read everything before she had arrived to Guam.
Yeah. And Dr. also seemed to
he was
kind of question that. Yeah.
So does that say that in the
Yes, sir.
guidelines and in the memos that babies need to be tested when they're, I guess, traveling and they arrive to Guam? That is mandatory? Because I saw there was like a 5-year-old and above.
So it also did say that if the physician advises it, that they should be tested as well.
Well, let me ask you about the other quarantine nightmare that we had this morning. Guy Rob that came in to Guam with his negative test. He's here to bury his little brother on Saturday. He's the oldest son in the family. Unfortunately, he had the bad luck to get on a plane from Hawaii with somebody who was positive. I know you guys know this whole plane thrown into quarantine. So Rob is asking to be tested so that he can go to his little brother's funeral. And he says public health advised him to either A, get the family to move the funeral, or B, attend the funeral via Zoom, which is totally insensitive, totally lacking in compassion. So what is the protocol? And this is a unique situation that these people came in on this plane. But he's saying if he's designated as a person who is high risk of exposure, then give him the test. So what options are available? Because it's so inconsistent. We just a couple weeks ago had people come in for a funeral, they got the waiver, and then they spread the COVID. So what is the protocol for a gentleman like Mr. Rob?
Okay, so for this particular, go ahead.
Doc.
So this particular instance, because they had a positive on the airplane, the protocol was if you were in close contact with that positive case, you would be quarantined for the full 14 days. If you were not in close contact with that positive, as they investigate, depending on where you were seated, you'd be quarantined for 7 days. So depending on where you were situated on that airplane and where the positive case was, it would be either 7 days for non-close contact and 14 if you were close contact.
And there's no option to test out?
Right, no. The medical director does not advise that if you are in close contact, you would be in there for full 14 days. That is under the advice of Dr. Manglonia. And she is following CDC guidelines.
So there's just no remedy for someone like Rob.
Unfortunately, no, sir.
How does that make you guys feel to know that this guy is coming here to bury his little brother? And it's unfortunate. I understand that you have the protocols and we're keeping the public safe, but when we hear it's okay for some people and not for others, I mean, and then I know this has got to weigh on you guys. And knowing this guy was just on the show, I mean, he's well informed, he's articulate. His family is just torn apart because he can't be there for his mother. He can't be there to say goodbye to his brother. Does that weigh on you guys?
It weighs on me. I mean,
Yes, definitely.
but it's it's COVID, right? And so we just want to protect everybody else from getting COVID. I know that this one particular person, came here to bury their relative, but we need to protect, the community. That is COVID today. I mean, if that was me, I would feel so bad, right? But in the interest of the community, we need to protect them from COVID.
Yes, and if I can just remind Chris and Bree, just a few weeks ago, we're dealing with the repercussions of funerals, and that's where cases have a link. And so that's what we're trying to avoid again is a further spike in cases and this is why we went into PCOR 1 and the governor had to make those changes in regards to funerals and rosaries, because she herself had witnessed, and she said it on the media, she's been to funerals and rosaries where people, not everyone was wearing their mask or practicing social distancing. So yes, my heart goes out to this family. Again, we are compassionate. We're humans. We feel the pain, and we are apologetic about the situation. But again, yes, we are having to look at the whole community of Guam, the health of the entire island of Guam. And so our concern again is to follow those protocols per the medical director. And again, it's not that we're trying to give this individual a hard time and not have compassion, but again, our first priority is the safety of the whole island. And based on our recent experience with funerals, and we've seen numerous cases as a result of those funerals, we have to take this unpopular but necessary stance.
Right, but then we have other cases where you hear about the lieutenant governor and the governor getting tested, multiple times, and this guy can't even get one test. So you see how people look at it, Annette, right?
The protocol is that because of his high risk exposure, where he was situated on the plane, even if he's tested, he still will not be able to get out per the recommendation of our director because of the time frame of the flight and being exposed. And so that's why the 7-day test out doesn't apply to him, because he was exposed on the plane and would need to quarantine. And so he did have a hardship exemption prior to getting on that plane, but during the plane ride over, that's where he had another high risk exposure due to his location on the plane. So that hardship exemption is kind of mute because now of his new known exposure on the plane ride over.
So basically, if I sat 4 seats away from the positive person on this plane, then I could go out. I could be released from quarantine. I could test out.
You could test out if you met. You could test out if you met the other requirements on the current quarantine protocol for inbound passengers.
Wow.
But if you're within the 3 rows of the case, then unfortunately, that's where the new set of restrictions come into play, as Dr. Kaneshiro mentioned earlier.
And then all these new restrictions are all in writing and have been produced to Mr. Shaw? Or it's just a phone call? Yeah.
Yes.
He has them all in writing, and we can look this up on Public Health's website.
We do have it. Yes.
So it really boils down to, well, you sat in the wrong seat. Yeah. That's what it sounds like.
So like if Rob was on the edge and the person next to him is probably out walking around. That's crazy.
Yeah, it's unfortunate where he sat.
Well, that's one way to put it.
And there's absolutely nothing that can be done at all.
No.
Besides move the funeral.
As per medical director. Right. As per medical director, 14 days.
Okay. Thank you, Bree. We got nothing, but I'd appreciate the director getting you guys on. I really appreciate it because, we need that public health presence during this public health emergency. So thank you for standing in and answering the questions. That's the best you can do, right? Yeah. And the best we could do is ask them. So.
And I guess, and we understand that you guys are overwhelmed with everything that you're doing. So we really appreciate you taking the time to come on. And maybe if there's anything that you would like to say to the community.
We would just like them to, under PCOR 1, we just stay home, follow social distancing, wear the mask, hand wash often. We need to stop the spread of this COVID, right? We're still seeing cases of positives every single day. We just want to make sure that it doesn't spread anymore. So please stay home and follow the guidelines so we don't spread the COVID anymore.
Annette is the lead of the contact tracing team there at Public Health. Your closing statement?
I echo what my chief, Dr. Kaneshiro, has mentioned, and again, to really emphasize, if you're sick, please stay home. Even if you think it's just a cough or a cold, please stay home, because that's how we can help contain the spread. And again, it's help us to help you. It's a community-wide effort. And yes, it's washing your hands, wearing your mask, and the social distancing. But please, to comply with the measures that are put out there in the guidelines so that we can help stop the spread and reverse this the course of the new cases, and so we can slowly transition back out of PCOR 1 and to open up our island again.
Well, thank you.
Thank you.
Thank you, Dr. K. Thank you, Annette.
Thank you.
Okay, we'll
Take
see
care.
you. Wash your
you.
hands.
Bye.
Stay home.
Josh,
Well, okay, that's the.
thank you.
All right.